Hello and welcome to Get Yourself Optimized. I'm your host, Stephan Spencer, and today we have Uran Berisha with us, founder and visionary of Unpain Clinic. Uran helps humans resolve chronic muscular skeletal pain, optimizing aging, increasing their athletic performance, and, for men, regaining their morning erection. Also, he mentors practitioners on proper shockwave therapy applications. Uran, it's great to have you on the show.
Thank you very much, Stephan. It's a pleasure.
So we met at through Genius Network, which is a mastermind that we're both in, and it's a great group of people. I was really impressed with the knowledge bombs that you shared in the breakout room at one of the recent Genius Network meetings, on virtual meetings, because of course because of COVID, we're not meeting in person. But I was so grateful to have been matched up with you so that you could share those wonderful tips, because we have a new baby and my wife went through a C-section, and you shared some incredible stuff about what women need to know about recovering from a C-section, even if it's been 1, 2, or 3 years ago. And maybe we should just start there, because that is how we started our conversation, going down the health and wellness
Yeah,
rabbit hole. So,
yes.
what is it about a C-section that women need to know to heal after the fact, even if it's looks like it's fully healed a year later?
Yes. So I'm actually just gonna go a little bit back because it's true what you said. It's like when I mentioned shockwave, the first reaction to people when they ask what do you do, it's I do shockwave therapy, and they think it's actually the shockwave for the head, the electric shock. So we're talking about actually shock waves, the sound waves, and how they actually used for regeneration. It's one of the most effective therapies in medicine for regeneration of pretty much any tissue from the skin to the bone. And then the second shock, even with my clients, and even that day on the Genius Network meeting, is when I tell people that actually scars are one of the reasons why you might have actually a chronic muscle skeletal dysfunction, and you keep going and seeing all kind of practitioners for lower back pain, neck pain, even carpal tunnel that is like way far from the core, and nobody knows that it actually might stems from that abdominal surgery. And C-section, it's a very common one. And with any surgery that is done in the world, specifically C-sections, it's a necessary, it's emergency, so it's actually saving mom and baby. But nobody thinks about the aftermath effect of that surgery. Now, when I compare the scars from the past to today, is old scars, they used to be like very keloid. You can see the whole medicine has been focused on the aesthetic aspect of the scar, but not much what is actually doing to the underlying structures. And the reason why C-sections or any surgery it's very important is imagine your skin. It's actually your outer brain layer. So your brain or your nervous system gets informations from the skin or proprioception, then gets information from the vestibular system or from the visual system. So just a couple examples. Visual system, if you see a car coming towards you, you're actually going to contract your muscles to avoid the car hitting you. Second one, if you actually hear a boom, now you're gonna again contract your muscles, go in protection mode. And then third thing is the touch. An example for that is, let's say you have a hot stove and the stove is very hot, but you don't see it, you don't hear it. And if you don't have proper feeling in your fingers or in your skin, then you might burn your hand. But if your skin can actually feel that heat, you're going to contract the muscles and remove the hand. So why, again, the C-section affects the body is that the moment that the skin is cut, there is a nerve ending damage that happens in that area. So your nervous system is not getting proper information from that side. So it doesn't actually know how to use the core muscles, how to respond to that stimuli from that area. And then what it does, it actually start moving or finding synergist muscles that do the same motion, and start using hip flexors and then the neck flexors. And that's where we say the nervous system, it's affecting your body from the software perspective. So it's not getting proper information, and that it's not responding properly. The second effect that you get from any surgery, and specifically again C-sections, is that physically the tissue it's actually cut. So when the tissue is cut, the body is going to start building scar tissues, adhesions, and then it start pulling towards that area. So it affects the pelvic floor muscles, it affects your posture, you actually go more in a slouch position, and then it doesn't matter what you do with those muscles until you treat that scar. From the software perspective and the hardware perspective, there's not going to be a relief in the body. And scars can have actually a local effect or global effect. So global effect is like, if we look at now from a traditional Chinese medicine, you can have a meridian that flows through that area, and due to the scar there's no energy flow, so it can affect the person in a physical aspect and emotional aspect as well, because no surgery, and specifically the ones the C-sections are, they're not easy, they're very stressful. So your nervous system will actually relate that scar to an emotional trauma. So therefore it's extremely important to treat any scar, regardless how long it's been on you.
Wow, that was an epiphany when I first heard it, and so I made sure that my wife Orion heard that, and she's very grateful to have heard that, and that there is a solution, that shockwave therapy is a way to heal this without having to continuously massage the scar or do other kinds of treatments that just address the symptom without addressing the core issue. And you said that essentially what you're saying is that the scar disrupted the communication network at the skin level layer, so that kind of mesh network isn't communicating well anymore, or it's just kind of cut off from the network, and thus your body is compensating, not using your core muscles, even though they're functional after you've healed from the surgery, but you still have the scar, and the body is saying, yeah, I'm not sure that I can still use this muscle. Is that essentially a good paraphrasing?
See, imagine this. Skin is just the outer layers, but it's the sensory layer. So that's where you have the sensor. Underneath the skin, now you have, again, the nerve endings, the fascia. So fascia, it's a layer that pretty much covers everything in the body. It's just recently, I would say about last 5-6 years, that medicine is going to actually try to understand fascia. So if we look at internally now, you have a skin outside, and then you almost have another skin that goes on top of the muscle. And the fascia, imagine it's almost like a fiber optic fibers. So it's the layer that actually transmits information. On surgeries, the fascia gets damaged. So now what happens is your nervous system has lost communication with that side. In the meantime, it has actually figured out what we call it an alternative pattern, but this pattern, it's actually dysfunctional. And what happened is your body doesn't like change. The nervous system, brain doesn't like change. It likes to learn one thing to be able to function effectively and efficiently. It just wants to repeat that thing. So after a while, those fibers, they heal. Let's say after like 5-6 months, a year, or there's a time that they never heal. But now the nervous system doesn't want to change the pattern that it has learned. So it always goes back to the default. Now, if you are under adrenaline rush, your body is going to literally go and use everything. But if you're just in normal circumstances, let's say you're doing abdominal muscle workouts and you do like 100 of them, but you actually don't feel the pressure on your abdominal muscles. You feel it more on your neck, you get sore from it. That's the sign that your core muscles are not functional. So your nervous system is not prioritizing them. It's not picking up them as the first resorts. It's bypassing them. So if you actually go and measure them with EMG sensors, there is a connection. The muscle communicates, it contracts, but it doesn't get picked from the nervous system as the first source as it should be. And I have a theory that anytime when you have a big muscle dysfunction, then the small muscles actually will suffer. So the example is, again, since we took C-section or appendectomies, the core muscles become dysfunctional. Now extremities actually suffer. So if you're a runner, you're actually going for jog now. This scar, it's affecting neurologically. It's shutting down the core glute muscles. So your body automatically, it's actually moving or it's overusing the hamstrings, the calves, and then the runner comes in the clinic and says, I have a plantar fasciitis, I have Achilles tendon. But you cannot actually have a tendon problem before you have a muscle problem. So the muscle becomes first dysfunctional, and then it moves all that impact to the tendon, and therefore now people get diagnosed with chronic tendonitis. You keep treating the tendonitis without actually treating the cause in the first place.
Gotcha. Well, I had an appendectomy. I had my appendix removed when I was, I don't know, like 5 or 6 years old. And back then, it was a big scar, right? A big cut. Not like these days where it's really a tiny incision and they use the laparoscope or whatever to get in there.
Yeah.
Very very more precise these days than back then. So I'm a runner, or was. I ran in high school and did track, cross country, and that sort of thing. So when I would get things like shin splints, is that partially because of the scar that I had?
Yes. Because what happened, and again, I never assessed you. This is the first time that we're talking about this, but I assume, and I'm pretty sure that probably your shin splint was more on the right side. And what happens is, like if you would feel actually the shin splint pain, you probably have it more on the right because you have, again, muscle dysfunction. You have a pulling coming on the right side on the hip that it disengages quadriceps muscles. So even though you were a runner, your quadriceps muscles weren't functioning properly, and therefore your body had to move all the impact to the tibialis anterior, which is a next muscle, and then that muscle gets so overworked. To some runners, actually, it causes also stress fractures. And again, if you would be in my clinic, we would actually start with the shockwave. And the main reason, again, why shockwave works about resetting the scars, because it's a pure sound wave and it produces significant amount of power of mechanical pressure. So the stimulate's actually strong enough to influence the changes from the periphery, what we call it, from the skin to the nervous system.
Right, and so the shockwave therapy is done on the scar, not on, let's say, the shin splints or the stress fractures, or maybe it's also done there, but the main issue that needs to be addressed, the core kind of underlying issue, is healing that scar and the fascia underneath it.
See, I'm going to talk a little bit about the shockwave, and then I'll get to the point of actually explaining what I would do in your case, or how I would treat you.
Okay.
So shockwave therapy uses pure sound waves. So it's the same technology as they break up kidney stones with. But orthopedic surgeons in 80s, they took this idea from urologists, thinking that, okay, I can break down a kidney stone with shock. They can break down a kidney stone with shockwave. We can probably break down a calcium buildup on the shoulder with shockwave. And then they did a couple treatments and they realized they couldn't actually break it down, the calcium buildup on the shoulder. But what happened later is the body dissolved that excessive calcium buildup on the shoulder joint. That's when they realized that actually shockwave therapy is stimulating, or it's inducing biological response in the body. It's not just that mechanical force. So it's this pure sound wave. It's not ultrasound. It's not radio frequency. It's not electric shock. It's a specific category of sound waves that is characterized by very high amplitude of mechanical power. So it's about 3,000 times stronger than ultrasound, but it's almost a million times slower than ultrasound. So the ultrasound that you get at the physio. So one shock wave only lasts about 0.2 to about 0.60 nanoseconds. So it's extremely short. So this vibration travels through the tissue. And in case of the scars, as soon as that mechanical force hits the skin, now the nervous system, it's like thinking, wow, what did hit me? What is this power that is hitting me? So it forces the nervous system to communicate with that spot, which actually bring back the pattern that always used to be there. So that's the first kind of update or software update that it does. And then as that mechanical power travels through the tissues deep, it creates what we call it cell cavitation. So it doesn't burst the cell, so it doesn't kill the cell, but it just like it taps the cell. So when it taps the cell, it causes actually biological stimulation. So it creates kind of a false injury in the body. So now the nervous system thinks, oh my God, I have an injury internally, so I have to mobilize all the cells to repair that injury. And what it does, it actually brings pretty much all the growth factors. It decreases inflammation in the area. At the same time, it actually brings the inflammatory cells to repair whatever it like invaded us. It helps the body release nitric oxide, decrease pain, and all those processes, they actually stimulate angiogenesis, which is a new blood vessel growth, and they trigger stem cell activation. So it triggers your stem cells to come and repair whatever is injured. So in your example, what I would typically treat you is, yes, we go and treat the appendectomy scar to reset the muscle function first, and then we go and treat the shin area to now deal with the consequences of your dysfunction that you had before. Because when a compensation is for a very long time in the human body, it becomes even though it's a symptom, it becomes its own independent condition. So then we would treat actually the muscle to relax it with shock waves. And the beauty or the ability of the shock wave is that we can reach up to 13 centimeters in the body without any side effects. So it goes pretty much beyond any other modality that it's able to go that deep, break down scar tissues, adhesions, so create optimal conditions for healing. So it physically relaxes the muscles, and then on top of that, it stimulates regeneration of that area. And people typically need only 3 sessions, once a week, or about minimum 3 days, maximum 15 days. And then after that, they allow the body to heal for about 4 to 6 weeks. There's no downtime, and they can still do anything that helps them. So if they want to combine it with massage, acupuncture, or any other modalities, it's totally fine.
Gotcha. Now, there are different types of shockwave therapy devices, right? There's the kind that works on scars, and then there's the kind that don't work, and the kind that don't work are the radial shockwave devices. Can you explain this further?
Yes. Yeah, I love actually this question already, because in the world, shockwave therapy has been misunderstood. So at my clinic, at Unpain Clinic, we call it true shockwave, because true shockwaves or extracorporeal shockwave therapies, those are the ones that the sound is the same as the one that is used for kidney stones. And this is the proper shockwave. In 1999, there was a Swiss company that actually made radial pressure wave devices. So it sounds as a jackhammer. They brand it as a shockwave and then they start promoting. So in the world now, you actually have more radial shockwave devices or radial pressure wave devices known as a shockwave. And the actual true shockwave device is known very little. So my suggestion for anybody that actually need this treatment is if it sounds like a jackhammer, that's not a true shockwave. The true shockwave makes much less sound. You don't feel any pounding on the skin, but it just delivers pure sound wave. If you combine those two, you get amazing results. Nothing wrong with it. But for the scar treatment, you must look for electrohydraulic shockwave or electromagnetic shockwave. So there are three types of generators that create true shockwaves: electrohydraulic, electromagnetic, and piezoelectric. The piezoelectric system is used mostly by orthopedic surgeons, so it's extremely precise. It's like the focal point is like 1 millimeter. So for scar treatment, it would not be ideal. So for scar treatment, what I use personally, what I prefer is electrohydraulic system because the focal point is much wider. So the more you actually hit the skin with a stimuli, the better effect and response you're going to get in terms of the muscle function. But radial pressure wave, it's still amazing for like relaxing the muscles and scar tissues, adhesion. So in your case, I would go with a electrohydraulic, treat the scar, and then I would go actually and relax the shin with radial pressure wave. So that would be amazing combination. But yeah, anytime when somebody is looking for shockwave therapy or true shockwave therapy, regardless your need, you have to look for electrohydraulic or electromagnetic shockwaves.
Got it. And how do you find a practitioner who has the right kind of device? Because a lot of times there'll be radial shockwave devices, the wrong kind for treating scars, and they're not going to use that full term, regardless of whether it's the piezoelectric or the what is it?
Electrohydraulic.
Electrohydraulic or electromagnetic. You're probably not going to find those on a Google search, right?
The first thing, probably just Google it that way, and then something will come up. But I'll give you some tips what you have to look for, kind of the names that the people or the industry uses. So look for focal shockwave. So that's actually from a German company stores. So they call it focal shockwave. For electrohydraulic systems in United States, it's actually a soft wave. So that's one name that they can look. The devices look different. So if you would look at the device, you'd see it as a big sound instead of almost like a jackhammer and a small metallic applicator on the top. So those are kind of the distinguishing feature. And probably, again, just like research their website, call the clinic and ask, do you use radial pressure wave or do you use actually true shock waves or electrohydraulic, electromagnetic? And the clinics that they use those, because they want to distinguish themselves and that they're using the right tool, they usually have it on their website mentioning it.
Got it. And is it easier to find the true shockwave in the States, or is it just as easy to find internationally?
In United States specifically, it's been just recent that true shockwaves have become available. I would say last couple years. In Europe, they're very common, even Asia, like around the world. But yeah, if you go with those names, searching specifically, focal shockwave and then those brands, you'll be able to find them pretty easy. Okay. So I don't see any problem with that. And always they can, I'm not sure, they can contact us directly at the clinic and then we'll help them find, depends where people are. So that's no problem. And we do that. We actually do that constantly. So.
Oh, that's very nice of you. Let me direct you
Yes,
to
yeah.
XYZ competitor in Orlando, Florida, near you or whatever. That's pretty cool.
See, it's we actually don't look anybody as a competition. It's interesting. We just want this therapy to be available for people. There are more than enough people that need this in the world. So we just want to help. So anybody, actually, we used to almost like check clinics. I have a lot of clients, that during the winter they go south because we're located in Edmonton, Alberta, so it gets very cold here. So they go south, they get injured playing golf, and then they look for something around. So we now start actually searching in the clinics, kind of taking them through survey questionnaire just to help that person. So we already have an idea based on the location who could be the right person.
Yeah.
And my staff already knows that, so that's no problem at all.
Yeah. Okay. So I already told you this, but it wasn't on this episode. It was in a private conversation, but I'm gonna share this for our listeners. I had a hair transplant back a decade ago now, which was amazing, life changing because I look completely
Yes.
different than I did before. Of course, the kind that I had back then was where they leave a scar in the back of your head because they take a strip of skin about an inch thick and they remove it and they take each hair follicle out of the skin and they sew you back up without that skin. So they kind of stretch the skin to pull it together, and it's very tight back there until it kind of
Yeah.
loosens up. But I have a scar that's covered by my hair, and
Yes.
I never thought a second thing about it until we talked. And then I'm like, oh,
Yeah.
what are the implications? How is this showing up in my life in terms of dysfunction or pain or whatever or tightness because I have this scar?
Honestly, that could affect in so many ways, so many aspects. We already talked how the scars actually affect the body in general from the muscle perspective, especially when it's on the head, on the cranium. It tightens up the cranial fascias. So this is from externally. So it actually puts more pressure in your head than normally you should have. And we have the sutures on the head, the bones that move. Almost like every time when we actually take a deep breath, your head expands a little bit. So we have almost like a diaphragm that on the head, then we have the diaphragm in the abdomen, and then we have it on the pelvic floor. So those three diaphragmas are extremely important for proper oxygenation of the body. And I tell everybody, if you want to know how important breathing and oxygenation is, don't breathe for 5 minutes and see what happens to the body. So that's why it's extremely important, even for you, Stefan. It's whenever you have the chance, like to get the treatment in those areas to physically relax the scar, because that could be a trigger. I'm not sure if you get any headache or not, but it could be related to headaches. It could be related to lack of focus, almost like feeling almost like a curtain in front of your eyes. And the reason why is because we have the suboccipital muscles on the back that actually control your head position. So literally, the whole body, it's trying to keep the head straight. So now when you have that physical cut of those structures on the head, it starts putting a lot of pressure on the C1, C2. And that interrupts the cerebrospinal fluid flow to the head and brain. So at this point, what you can start doing, it's almost actually massaging every time. If you like, you're listening to a podcast or you're reading, you can hold the book in one hand and try to massage your head. Try to actually pull a little bit the hairs up. Like that way, it's you create or you release those fascia restrictions, so your lymphatic system or lymph flow can actually start entering those channels, and it almost like start lubricating the tissue. So, and then yeah, whenever you have the chance, again, shockwave, very low intensity to treat all those areas. And it's interesting because we adapt to so many dysfunctions and it becomes normal to us. And until you actually get treated, you don't know, you don't realize how much it was affecting. And I'm going to share a personal story with you. When I was 5 years old, I had a hernia surgery myself. And as a teenager and growing up as a young kid, I was a competitor cyclist and a swimmer. So, but I always had a big belly. I could never understand why I was so built the rest of my body, but I actually had belly. And I learned actually neurokinetic therapy, how the scars affect the body, the motor function. And that's when I realized, like, whoa, my core muscles, they never worked properly. And the way how they were telling to treat a typical, like resetting the scars, like massaging and doing all kind of stuff just to send signals. And I said to myself, wow, I can actually do this in matter of seconds with shockwave. And I treated my scar. And a couple weeks later, people told me, oh, you actually you lost weight. No, actually, I didn't lose any weight. It's just my muscles are actually engaged. And now everybody knows if they come to our clinic for treatments, the first thing that we do is we treat the scars, we clear that, and then we work on anything else. And the good thing is that it's a permanent improvement. If you do actually 2 or 3 sessions, you never have to go and treat that area again if you use the shockwave.
So are you ripped now in your abdominal area? Do you have like a 6 or an
See,
8 pack?
I have 2 packs currently, and I actually tease my wife. I say, you know what? The other 4, I'm just going to order them online,
I don't think it works that way, but
Uh,
okay.
yeah, yeah, I know. It's one thing actually, Stefan, I pay attention or focus and I advise every client is you have to always think about balance. So if you feel good, if you feel healthy, if you're able to do things, that's what your goal should be. Because sometimes even just focusing on like building the muscle, putting that much effort on the body, if you're already a stressful person, you're causing a lot of stress, and now you're asking your body to actually, let's say, let's do a marathon, you're putting again your nervous system in stress too. So because I work in the clinic, 3 days a week, 9 to 6, I spend a lot of time indoor. So what I do is I try to go more cycling. I try to pay to spend more time outside, so that way it balances out. And plus, I do every morning. I have my workout routine, but it's not intense.
Okay. So back to my issue. I'm going to selfishly go back for just a minute or two to this issue of the scar on the back of my head. So would that show up perhaps as me carrying my head forward? Because I've always heard that I carry my head forward because I use my computer a lot. If you're at your computer for many hours in the day, it's pretty common to have like a forward head sort of issue. And so I'm curious if that's potentially related. And then the other is I have a lot of tension and tightness in my traps and in my shoulders and neck. And so I'm guessing that's probably related as well.
Exactly. So there are actually 2 things here. See, human body is designed. If let's say if the body is functioning 100%, you can pretty much do anything with your body, and it should not hurt. We're not a static, system. We are a dynamic system. Muscles contract, relax. Yes, you're gonna adapt more to the activity that you do, whether it's like a sport or just sitting on the desk, but it's not the main reason that you have a head forward posture. To me, where I think it's coming from your appendectomy first, because your core muscles are not functional. You're overusing your hip flexors, which is pulling your spine a little bit forward. your neck flexors have become your primary movers for the core area, what we call it the frontal chain. Now your upper trap muscles, your head, it's actually not being supported from the flexors anymore because they're almost doing like completely different things. So now your head, it's actually only held against gravity by the upper trapezius muscles and the neck extensors. So that's why they're getting super tight. But then with the fascia being, pulled from the hair transplant and all that intervention, that's now affecting where the upper trapezius muscles attach, which we call it the ligament nucleus, just behind your head there. And if that gets super tight, it doesn't matter how many stretches you do. It doesn't matter what exercise you do to correct it. It will not correct. And the reason why I say this is because let's say now you get a postural exercises to do. You're giving your nervous system a task to correct this posture, those muscles. Guess what? Your nervous system is only going to pick the muscles that are already working because you're challenging it. So where that tension goes more to the upper trap muscles. And then now you have so much pain and tightness on the upper trap muscles. You go and seek help. You go and see massage therapists. They dig in with elbows, trying to actually loosen up the muscle. But your nervous system, it's actually overusing that. And there's no way that you can relax that muscle with muscles. And when I say that is because the therapist hands are muscles. So now you're trying to actually, you're almost causing a friction between two muscles. So you get the temporary relief, but there's never permanent improvement. So you go back to the scar. If, let's say, due to the COVID now, like so many things are restricted, if you want to help yourself just temporarily until you have the ability to treat yourself, take a kinesio tape, put it on that appendectomy scar when you go for a run, when you do activities, or you know yourself that you're going to be sitting in front of like you have all those meetings. That could be actually a tip that could decrease the upper trapezius muscle tension. And always, I'm not against exercise. Exercise, everything in medicine that we do in rehab medicine, is actually to bring the human back to the perfect motion. So you must do the exercise, but first you actually eliminate this dysfunction, then do whatever you want with your body.
Got it. Okay. Wow. So stretching won't correct it. It's going to need to be addressed at the core level, at the root level, with the shockwave, the true shockwave treatment. What if you don't do the shockwave treatment? And okay, so you mentioned kinesiology tape could be a way to just give it a little bit of help. But what are some of the other ways that you might address it?
Yeah, if you cannot find shockwave, true shockwave, then go and get lasers. Go and, like, even if you massage it yourself, like touch it, but it might take months before it resets because touching it, it's a very low stimuli. You can actually go and get acupuncture. There's some acupuncturist that works with needles. They go and they needle the scar, so that way it physically releases the scar. And as they needle a bit, that actually creates mechanical stimuli on the nerve ending. And sometimes the nervous system actually picks that up.
Okay. Are you a fan of laser therapy, or you just think this is like a less than ideal scenario if you just don't have shockwave therapy available to you?
Honestly, shockwave, the reason why shockwave, it's considered, especially from my perspective when it comes to like all modalities, it's pretty much the top one, is because it's causing a physical stimuli. Like you feel it when it goes through the tissue from the body. You feel the impact, the vibration, versus a laser is just a light. So for the laser to actually turn to mechanotransaction, like to be able to physically stimulate the cells, you have to really increase the intensity. It releases the heat. There's a potential damage from it. So there's so many things. So therefore, for the scar, from like lasers, physically, aesthetically, they can make the scar look much pretty because the heat actually releases the collagen fibers and stimulate collagen production, and it changes that way. but not in terms of the stimulation because it's a light. So we rather use actually a sound, because sound, you actually feel it. It doesn't, like example, you can go outside, you see the light, the sunshine, you feel the heat, but you cannot feel it physically as same as if you're close to a speaker. That's pretty much the differences.
Got it. Okay. So from an aesthetic standpoint, it could be helpful to use the laser to make a really pronounced scar that's very obvious.
Yeah.
People can see, like if you're wearing your
Yeah.
your bathing suit, and people can see that from very far away. You might want to try using laser on it, but you also should use the shockwave therapy on it.
Yes. Yes. Yes.
Okay.
Yeah.
So I'm curious if someone has like neuropathy, like I have in my left index finger, what they call a Morton's neuroma. It's just kind of a catch-all for anything that they can't see on the MRI that is nerve pain.
Yeah.
It's nerve damage. I don't know how it happened, but it was like 5 years ago, and every time I bump this finger near the tip on the inside, it just feels like a hammer was taken to it. It's awful, and I kind of resign myself to having to live with it the rest of my life.
Yeah.
Is shockwave a potential treatment for that?
Oh my God! Yes. Yeah. So anytime when the nerve get actually interrupted, or because motor neuroma, it's pretty much a scar tissue build up, that it's almost like bundling the nerves. So however that happened, you don't know. It could have been, you hit your hand somewhere, you caused like a little bit small injury on your hand there. And hand is very sophisticated, specifically for fine movements. So even a little injury in that area can actually be very sensitive to like scar creation and adhesions. And then imagine a very small scar on the hand. It's a lot versus on a hamstring or on the thigh area. So now the nerve can be hypersensitive or hyposensitive. So in your case, it's hyper. So it has become very sensitive. Shockwave, it would help more than anything. And I'm talking this about my experience. We treat in regular basis motor neuromas on the feet, and it's the effect. Doesn't matter how long it's been, it's minimum 70% and up. And that's within 3 sessions. And the reason is that it actually breaks down scar tissues adhesions on that area, and then stimulate angiogenesis, which is a new blood vessel growth. So then your body starts dissolving that scar. And then about 4 to 6 weeks later, after shockwave application in that area, you're going to have 200 to 300% more blood circulation. And then about 8 to 9 weeks later, you're going to have actually the stem cells that come and repair whatever it's injured. So yeah, definitely. Whenever you have the first chance to get it treated, I would highly recommend it.
Oh, wow. That's exciting. Because I've tried lasers. I've tried stem cell therapy directly injected into that site. Didn't help. Neither one.
But see, I wanna add a point here. Anytime when you do injections, and you're actually asking the body to, what I call it is like helicoptering the cells. You're moving the cells from one side to the side where you think you have potentially problem and injury.
Right.
My suggestion, how I would typically treat you, I would go and treat your scar first. We talked about like appendectomy, the cranial scar, because you had the appendectomy like way before anything else. So we bring the muscle function back. So your core starts functioning and it offloads your extremities. So regardless where the injury is, that's the must, that's the foundation. And then when we would go and treat your motor neuroma on the finger there, is because the shockwave has the ability, again, of the mechanical power in that area, it breaks down the scar tissue's adhesions, which actually creates optimal conditions. It cleans the area, it prepares the area for healing or for those cells to come. And because we have caused kind of a false injury, so your nervous system is triggered. So now you have the nervous system control that it's actually dictating the healing, and it has stimulated the healing, and not just like bringing a cells from another body part. And now what this cell is going to do, if you didn't actually trigger or stimulate, or what we say, if there's no cognitive recognition from the nervous system, the cell doesn't know what to do. It's almost like you're bringing a construction guy to repair something, but you don't provide a plan, you don't provide, the place or nothing, and just say, you know what, build something. Okay, what I'm going to build, because those stem cells, they have the ability to turn to whatever, tissue or form it needs to be. And that is actually that decision, it's made in the nervous system, because now the nervous system, it's been stimulated. So if you would actually have shockwave first and then you do the stem cell, you would have amazing results, because you already triggered the stimulation. Now you can overpopulate, and chances are much higher, same as with PRP, prolotherapy, or any other form. So shockwave doesn't interfere with anything else. It can just help and benefit the area.
Wow, that's really good to know. This is enlightening. What about carpal tunnel? Like, so many people suffer from carpal tunnel, or just from wrist pain or hand pain because they're on their computers all the time, especially now with us not being able to get out as much. Many of us under lockdown, or our movements are restricted. We're not able to go to the gym. So we're sitting at the computer, yes. We're sitting on our phones, we're typing away all day long, getting inflammation and getting carpal tunnel. So how do you prevent this? How do you address it once you've got it? And I know shockwave is going to be a key answer to that question. But
honestly, the first thing with any condition, because personally I don't like to tie myself to like names, because we cannot treat the name, we cannot treat the diagnose. So even with carpal tunnel, we approach it, or the way how I would suggest to approach it is, okay, first trying to understand what's going on with that body in general. Because as I said earlier, is you're designed to do anything with your body once everything functions properly. So with carpal tunnel, we make sure that there's no surgery in the body. We clear that. The second thing that we go and look at is like how your shoulder is actually functioning. Because if you're sitting in the computer all day, that usually doesn't hurt you much. What hurts you more than that is, let's say you have a pinched nerve on the neck that it's affecting your deltoid muscle. The deltoid muscle is this powerhouse muscle, the biggest muscle that moves your shoulder, lift your groceries, like you do everything with it. If you have a dysfunction on the shoulder now, and what your body is going to do is going to actually look, okay, I'm holding this like 10-pound grocery bag. I need to like carry from the store to my car. The deltoid muscle is not working properly. What muscles are going to actually hold that and carry that? It's usually the forearm muscles, because we touch. Our hand takes more space in the brain from the sensory input than anything else. So now they actually take over. So what that means is that you're overusing those muscles on your like workouts and daily activities and all that. So that's where the tension is created. When we talked early, if you have a tendon problem, you first have a muscle dysfunction. So your focus should be actually strengthening, rehabbing the shoulder muscles. So then it offloads the overload on what we call it the forearm flexors. Because with carpal tunnel syndrome, what happens is those tendons of the forearm flexor group, as they pass to the hand, there is a layer that covers. It's called the retinaculum. So due to the thickening of the tendon and the thickening of that retinaculum, it actually compresses the nerve and the blood circulation, and therefore then you start having the symptoms of carpal tunnel. So my approach is, first thing is you can massage your muscle that moves your thumb, the thinner muscle. Try to loosen that up. Use heat actually on the forearm flexors, and then go and do some strengthening exercise, but very easy, lightweight. And I say, if you want to reset a pattern of a muscle, you cannot go and challenge the muscle. You have to go like baby steps. You have to learn first the alphabet, and then you can add to that muscle later on. So then you're actually strengthening the muscles of the deltoid of the shoulder. You make sure that your scapula, it's actually in proper position, and you'll see that automatically your carpal tunnel will start feeling better. In chronic cases that carpal tunnel has been, for 10, 20 years, we still approach it the same, but then you might need more like the shockwave or anything that would relax that local tension.
Got it. Okay. Now, I know we're almost out of time here.
Yeah.
Alzheimer's, big question here. So
Yes.
let's answer it briefly, kind of a lightning round here. So, Alzheimer's, what can we do if a loved one is starting to show signs of dementia, and it seems like there's really no way to help them, but is shockwave a potential amelioration of Alzheimer's?
Yeah, last year for the first time, actually, shockwave therapy got C approval for Alzheimer treatments. This is in Europe. So shockwave, it's used pretty much for heart regeneration, for muscle skeletal regeneration, everything in pretty much in between skin and bone. For men's health, erectile dysfunction, because again, stimulate new blood vessel growth, it improves that. And then now for Alzheimer treatments. So locally, it's actually stimulating the brain and to increase the blood circulation in that area. And it helps. It doesn't cure it though. It doesn't cure Alzheimer, but it helps the symptoms of Alzheimer for at least 4 to 6 months. So this is what we have learned. For spinal cord injuries, it's actually almost like a standard application in most of the hospitals in Europe. But one thing that I would kind of a hierarchy of the way how the body functions. And when it comes to Alzheimer, it's hard to kind of respect that, but you have to follow it. So everything starts from the emotional aspect. Like any disease, any problem in the body starts there. It affects the lymph system. So the lymph system, it's actually our sewage system. It doesn't matter what car you have, what engine you have. If you clog that exhaustor, the engine doesn't work. So you have to maintain a proper lymphatic system. If the lymph system is not working properly, it affects the gut. So then it's going to affect your nutrition. And then we go to the gut and brain connection. So your whatever you eat, that nutrition is going to affect your blood. So then that nutrition has to go to like different organs in the body. So gut affects blood. Blood affects organs. Then you have the organs, whatever you feed them with, that's how they're going to be. And then organs affect the muscles. So anytime when we have a chronic mystery, condition, whether it's like Alzheimer, whether it's like plantar fascia, this is kind of the hierarchy that we have to follow to really figure out the cause of that problem.
Gotcha. Okay, so last quick question. If you could make the sound of the radial, the wrong kind of a shockwave, I know you've got it on your computer. It sounds like a jackhammer. And then the right type, can you play those two sounds so we can hear the difference?
Yes, I'm just going to do that right away here. I'm just sharing the screen.
So if our listener wants to work with you, your team, get help with their pain, and they are willing to fly to you or they live nearby, how do they get in touch? And if they want to just learn from you, what's the best way for them to follow and subscribe and all that sort of good stuff?
So my mission is to actually help 1 million people to reduce pain by 75% by December 31st, 2022. So that's our mission as a clinic, and mostly in musculoskeletal pain. So anybody that deals with chronic musculoskeletal pain, they can go actually at our website at the clinic, unpainclinic.com. We have an option for people to book a free telehealth session consultation wherever you're in the world, you're listening the podcast, Get Yourself Optimized here. You can actually book directly with me. It's free. I'll help you wherever you are to guide you what you need. Okay, so this is what I want to do for people that listen to you, Stephan, and anybody in need. We are just, it's interesting, we function as a clinic based on word of mouth. So this is now, due to the COVID, has reduced, the word of mouth, the socializing. So now we are coming out to the world with podcasts. So we're going to have our podcast as well and other things. But yeah, website, it would be probably the first place. And that's how we can.
Unpainclinic.com.
Correct. Yes.
Awesome. Well, thank you, Uran, and thank you, listener. I hope this was inspiring. If you have any kind of pain and it could be addressed by Shockwave, you owe it to yourself to go check that out. And we'll catch you on the next episode of Get Yourself Optimized. I'm your host, Stephan Spencer, signing off.